This show is part of the Recovered Life Network. Check us out at recoveredlife.tv.
When patients rely on daily prescription medications to manage complex neurological or psychiatric conditions, trust in manufacturing quality controls is paramount. Conditions like epilepsy and bipolar disorder require strict, uninterrupted treatment regimens to maintain stability, prevent sudden seizures, or avoid severe mood swings. But according to a nationwide safety alert reported by WPRI and issued by the U.S. Food and Drug Administration, pharmaceutical manufacturer Taro Pharmaceuticals launched a voluntary nationwide recall for specific lots of 100 milligrams Lamotrigine tablets after discovering a critical manufacturing flaw: cross-contamination with a completely different drug. The investigation revealed that during the manufacturing process, a specific lot of Lamotrigine became contaminated with small amounts of Enalapril Maleate, a medication primarily prescribed to treat high blood pressure and congestive heart failure. While accidental exposure to enalapril can cause sudden drops in blood pressure or kidney complications in typical patients, the risk is particularly dangerous for pregnant women, as the blood pressure medication carries a severe risk of causing birth defects or fetal harm. Because Lamotrigine is frequently prescribed to women of childbearing age managing bipolar disorder or epilepsy, the presence of an undisclosed secondary drug triggered an immediate, high-priority safety recall. What makes this drug alert particularly critical for patients is the delicate nature of stopping antiseizure or mood-stabilizing medications. Neurologists and psychiatrists emphasize that patients should never abruptly stop taking their Lamotrigine without consulting a doctor or pharmacist. Suddenly quitting an antiseizure medication can trigger withdrawal seizures or severe psychiatric instability. Instead, health officials advise patients to immediately inspect their prescription bottles for affected lot numbers, contact their dispensing pharmacy to secure a safe replacement supply from an uncompromised lot, and report any unusual side effects directly to their healthcare provider. Ultimately, this nationwide recall serves as a crucial reminder of the rigorous oversight required across global pharmaceutical supply chains. While manufacturing cross-contaminations are rare, rapid regulatory intervention and transparent public reporting ensure that compromised medications are swiftly removed from pharmacy shelves before causing widespread harm. By staying informed, verifying prescription details, and working closely with healthcare professionals, patients can safely navigate drug recalls without interrupting their essential ongoing medical care.